Dr. Jones, I would like to talk to you about dentures. And apparently 30 million people in this country wear dentures. Now, I wanted to actually talk about two things in this denture thing. Number one, there has been lately a whole bunch of news about denture creams being maybe nerve damaging physically and mentally. I mean, the pictures I saw on television from the people who have been damaged are pretty bad. Now, it's obviously not 100% proven that the denture cream is bad, but let's assume it isn't. I want you to shed some light on what you think. But I have definitely heard and found out that actually there's no need for denture creams if you do the right denture in the first place. A denture will always deteriorate and eventually need cream. It's not that the denture changes, it's that our mouth changes. You explained that when the roots is out, the bones shrink. So it's like with me. I need new trousers every so often, but unfortunately I don't need smaller ones, I need bigger ones. So, but apparently there's a thing called implant-supported denture where 2, 3, whatever, depends on the person's implant gets put in with the denture gets stuck on it, and apparently it literally is like a world of difference to a normal denture. So shed some light on those two topics, denture cream. Frankly, personally, thanks God I don't have one, and hopefully will never have one. But I can't assume that it is a nice thing to put cream under your gums and, oh my God, I mean, a person will want to stay away from it whether it's dangerous or not, in my opinion, but you tell me.
Right. Well, denture cream for sure is only a Band-Aid to cover a bleeding artery, basically. The denture cream will go in, only lasts a very, very short time, and then it's something that's in your mouth that you're swallowing. It's not very hygienic. Bacteria gets all in it. It needs to be cleaned out every day. And there's really no need for a denture cream anymore because of the use of dental implants. When somebody has a full denture, whether it's an upper denture or lower, or sometimes both, they'll have an upper and a lower denture, both of the jaw bones will start to dissolve away because they don't have tension and compression on their jaw bone. And so from time to time, a new denture or a reline procedure has been a stopgap method to make that denture fit a little bit better, but the process continues. It doesn't stop. It just
and again,
continues.
as you mentioned in another video, as we said, that is also this happening, the bone shrinking also adds on 5, 10, 15, and 20 years to your face. Basically, you start looking like an old hex, like riding on the broom type of person.
Yes, but a dental implant, or maybe 2 or 4 dental implants on an arch, can stabilize a denture to where a person not only doesn't he need denture cream just to hold it in place, but now it's something that functions better. They can start chewing things that they haven't been able to chew before because their dentures just have moved all over. They don't get the food underneath as much because it's just easier to clean out and sweep out. So there's just a myriad of problems that have a solid foundation.
What about the tasting of the food? I heard that when you have a normal denture, you have some plastic or metal plate over your palate, and with the denture implant you don't. Is that true?
That is true. You can take the palate out of a denture, and now the full roof of your mouth is now available to your tongue and to your taste buds, so that the food actually does taste better, and you can feel the texture of it better. And it's not doesn't feel like some two pieces of plastic that are trying to rub this food together, and you get a plastic taste with everything. And it's not that way anymore. You can not only have a solid denture, you can get rid of the paste that you've been tasting along with your food, but now you can really go back to tasting real food and to enjoying foods you haven't been able to enjoy in a long time. So there's a definite advantage to having dental implants secure your denture. And it doesn't take a whole mouthful of implants. You don't have to have, if we have 16 upper teeth and 16 lower teeth, you don't need 16 implants. You can secure a denture with 3 or 4 implants on the top and 3 or 4 implants on the bottom, and make it very functional and get a situation for yourself that is just so much improved to having the dentures by themselves or using cream or powders to try to hold them in place?
Give me a couple of yes and no answers here.
Okay.
If you have an implant-supported denture, which to me looks like it's a phenomenal hybrid, you don't spend these thousands of dollars, and yet you get a phenomenally improved biting. So let's get to this biting. If you have one of those implant-supported dentures,
yes,
can you bite into an apple? Can you chew on a 4th of July barbecue rib?
Yes, you can.
That sounds great. I mean, that's for all purpose all we want. Because you cannot do that with a normal denture, can you?
Not anybody I know.
Wonderful.
No, the denture will fall right out if you try to do that.
Right. In fact, I know a few people or have known a few people. I can't think of anybody right now who have dentures. One thing you find out that is they become insecure. Like sometimes we feel sometimes insecure, whatever it may be. It may not be really there. So when they talk in a group of people at a restaurant or wherever, they feel a little. Their denture would probably not come out speaking. It would probably not. The big joke, the denture falls all over the table under the queen's lap or whatever. That's probably not going to happen. But just the feeling that it could maybe possibly happen makes people feel insecure. And it looks to me like one of those implant-supported dentures will take that one away just like that, right?
Well, Helmut, self-confidence or just confidence in general, it just goes a long way anywhere in life. Whether you're at a function with family or whether you're at a business function. And there are many, many people that have dentures that are still in the business world. And unfortunate that they have to have dentures. And now their confidence level has been shaken because they don't know that whether or not that denture will get loose or whether it will float. It probably won't fall out, but what if it just moves altogether? And with dental implants, their self-confidence comes back. And now they know they could go into any meeting. People are not going to know at all that they have dentures because they're going to be solid inside their mouth.
Beautiful.
And that one fact alone is just worth so much.
Right, and obviously there have been so many more which you covered. Now, one more fast, we don't have that much time anymore, fasting. If a person has been wearing, using cream, and he does feel a little bit tingling in the extremities, a little numbness in the limbs, in the muscles, maybe some type of memory problem he thinks is not there. Again, it's not proven that this it's the zinc which is in the denture cream. It is really the big problem, and probably they're already changing it, but still it's going to stay a chemical one way or the other way. But if a person has that, would you say that he should go and go to a physician and get maybe a nerve examination and one way?
Absolutely.
Yeah.
Absolutely, I would, because there still are some chemical tests that can be run. There are, many ways that physicians can help them. But the first thing is to try to take out any unnecessary chemicals in the first place. And by doing that, you can now be helping yourself by starting to eliminate things you don't have to have. And if you have a dental implant holding an implant-supported denture in place, you can immediately rule that out. Should you have a physician check out these kinds of problems? Yes, you should. And I think that will go a long way. But if you can help yourself at the same time and eliminate the things you already know are unnecessary, then how much more have you got to jump on the problem to begin with?
Thank you very much, Dr. Jones.
My pleasure.